this is where I get so frustrated because when women are put on birth control, we're just not told of these side effects. We know, obviously know the big ones, like there's increased risk of blood clot, stroke, and I feel like those are the only ones that are really talked about. But then there's this whole slew of other things that are happening beneath the surface. Like it's affecting us. It is affecting our physiology in ways that we don't know. And I'm not here to fearmonger. Like that's not my intention of sharing all of the side effects of birth control. I just want women to understand what is happening beneath the surface when we're on birth control so that we can have informed consent and have knowledge so we can take action on counteracting those side effects so that when we do come off, or even while we're still on, we're supporting our bodies as best we can. So
in today's video, I had the pleasure of interviewing Jenny Mahoney. Jenny is a functional dietitian who specializes in women's health with a focus on acne, hormones, and gut health. Her own hormone struggles after quitting birth control led her to create Birth Control Breakup Club, a passion project turned powerful resource that empowers women with the knowledge and tools they need to support their bodies through the transition off hormonal birth control. From hair loss and acne to irregular cycles and digestive struggles, Jenny helps women navigate these symptoms with a root cause, personalized approach. Jenny's deeply passionate about helping women understand the inner workings of their bodies so they can feel confident, capable, and in control of their health. In today's video, Jenny and I spoke about what birth control does under the surface in the body, how to prepare your transition off birth control, or your transition on birth control. We ended our interview with a brief discussion about acne root causes. Jenny provided her top tips on how to address acne from a functional medicine lens. Before we head into the interview today, please give this video a like, share it with a friend, and hit that subscribe button if you haven't already. Now on to the interview. All right, I am joined today by Jenny Mahoney. Mahoney, is that how you say your last name?
that is correct.
Awesome. Jenny and I have become Insta buddies, at least I would say we've been Insta buddies over the last few years. And I'm really excited to have Jenny with me today because when I was thinking about birth control and when I was thinking about these, commonly recommended interventions for women with endometriosis, like you think birth control, right, or some kind of hormone therapy. And I have to say, Jenny, you're like the go-to person for me when it comes to birth control and transitioning off or going on, like what are these considerations? And, like I alluded to, it's a very common recommendation for women for managing pain or other endo-related symptoms. So I'm really excited to dig in with you today on this topic. Before we jump into the more birth control, hormone therapy specific questions, if you could just give our listeners a bit of an intro, who you are, what makes you a great person to talk to on this topic.
Yeah, so I feel like most functional dietitians that we land in the space of root cause healing, I too went through my own journey. I was kind of thrown into this space, trying to, forced to figure out my own issues. So I actually started out as a clinical dietitian in a hospital. I feel like that is the path for most dietitians. We start in the clinical space. I worked full-time in a hospital, serving patients on a stroke floor and on acute rehab. So it was a lot of old people, heart healthy diet educations. People didn't want to hear what I had to say, and I was just kind of clocking in, clocking out, didn't really feel like I was helping anybody, and got burnt out pretty quickly. So from there, I went to go work at a fitness center where I was introduced to functional medicine, and it was a perfect transition because I was also coming off birth control at the same time I started this job, and I developed all of these symptoms about 3 months after I quit birth control cold turkey. My hair was falling out like I was postpartum. It was crazy. The worst part was the acne. I developed really painful acne, and it really affected my confidence. It was all like on my jaw and my chest and my back. And I remember driving. My husband's family was about 4 hours away. We were driving for the holidays to go visit. And I was like, it hurts to wear a seatbelt because it's like pushing on all these lesions. And it was, it affects you so much physically, emotionally, and mentally. So that was the hardest part. I gained about 12 pounds and didn't change. If anything, I was eating better and exercising more. I was working out in a fitness center. Mood was all over the place. I remember crying for like no specific reason. So really that honeymoon phase of our marriage, I just gotten married and came off like right after, and it was a shit show. Can I say shit? It was a shit show, to be honest. For about 9 months, I struggled, and I went to my OBGYN for like a regular women's checkup, and I'd been working with a fertility awareness educator at the time, learning like, how to practice contraception naturally, and she had alluded to maybe my symptoms were indicating low progesterone. So I was at my OB office, mentioned this to her, and I was like, can we test my progesterone? And she said, we can test it, but I'm not going to put you on progesterone unless you're trying to conceive. And like, that really pissed me off because yes, we need progesterone for a pregnancy. It's a progestational hormone. But at the same time, progesterone is important for other things too, like quality of life. And so it was just really disheartening that she wasn't really hearing me. And she's like, just keep writing it out. I'm like, well, it's been 9 months and I'm really, quite honestly, I haven't felt like myself and it's affecting me. So at that point, I was like, you know what? I have the functional medicine info at my fingertips. I'm just going to start researching and doing things on my own. And it's just kind of snowballed from there. It's been 8 years, and I left that job clearly at the fitness center after about 1.5 years, 2 years, and decided to go into my own private practice and specialize in women's health and hormones. And I work with women one-on-one primarily for hormones, gut, skin issues. But I have this special passion project called Birth Control Breakup Club, helping women avoid exactly what I went through, or if they're going through what I went through, to have a safe place to land, for them to be heard and have action steps to take instead of just being told, write it out.
Love that, love that. And I can totally relate to you. I was taking birth control for some time for endo-related symptoms, and for me, and like I'm sure you see this in your practice too, but my symptoms started even before coming off the pill. Like I started spotting, I started having all these like mood shifts, and my doctor's solution was to put me on a stronger pill, and I was like, that just doesn't sit right with me. And then began like 2 years of hell where my mood was just terrible. I was spotting, my cycles were the worst they ever were. So I'm so happy that you've developed this passion project. I'm sure it's helping a tremendous amount of women because, gosh, if I had something like that back then, I mean, luckily, in my case, I was able to dig myself out of it, but it sounds like...
Now, were you on progestin-only birth control?
No, I was on a combo pill.
You were, okay. Yeah, interesting.
Yeah, this was like, oh my goodness, over a decade ago now.
Yeah.
Probably around there, so yeah, a while back, but so relatable, so relatable. So before we go into kind of what are some of these like foundational things that you work on inside Birth Control Breakup Club, can we talk a little bit about like why do some of these symptoms even happen? Like what is happening beneath the surface when you take a birth control pill, whether it's progestin only, whether it's a combo birth control? What's happening beneath the surface that's like eventually leading to these changes when you transition off? And I know that that's a massive question, so maybe if you could just give us like a couple of these physiological effects.
And it can vary from the type of birth control that you're on, different side effects. But I feel like this is where I get so frustrated because when women are put on birth control, we're just not told of these side effects. We obviously know the big ones, like there's increased risk of blood clot, stroke, and I feel like those are the only ones that are really talked about. But then there's this whole slew of other things that are happening beneath the surface. Like it's affecting us. It is affecting our physiology in ways that we don't know. And I'm not here to fearmonger. Like that's not my intention of sharing all of the side effects of birth control. I just want women to understand what is happening beneath the surface when we're on birth control so that we can have informed consent and have knowledge so we can take action on counteracting those side effects so that when we do come off, or even while we're still on, we're supporting our bodies as best we can. So the first one that comes to mind is really disrupting the gut microbiome. So it depletes our good bacteria and creates an environment where we are more prone to overgrowth of bacteria, yeast, pathogens. Can put us at higher risk of vaginal yeast infections, which I see all the time in relation to birth control. Yeah. One that is not as widely known, though, is increased risk of Crohn's disease. There's a 300% increased risk of Crohn's with birth control.
I had no idea.
And I haven't had a lot of conversations of women that with birth control and Crohn's, but I've had a few of women that were diagnosed with Crohn's while on birth control. And in our DMs, I'd shared that information. They're like, what? Like, no one's ever told me this. And it's just like, wow. Maybe doctors don't know. I don't think that they have ill intentions, but that would be my first thing. If I'm on birth control and diagnosed with Crohn's, I would be off birth control so fast.
Yeah.
And working on gut. But yeah, gut's a big one. It increases inflammation, and the research was done with pill users. Women on birth control pills have 2 times increased C-reactive protein, which is an inflammatory marker,
Wow.
2 times higher than women who are not on birth control pills. So that's a big one. And obviously with endo, it's inflammatory driven, so that's a big side effect. Nutrient depletions. So, and I work with women who have been on birth control for 10 plus years, some even in 20 plus years. So the amount of time that we're on that birth control, we're depleting certain nutrients like B vitamins, magnesium, selenium, vitamin C, zinc, and we need to be replenishing these.
Yeah, I mean, all of those so important to consider, especially in like my niche population. But the last one especially, like these are a lot of the same vitamins and minerals that are key to supporting your body with endo. Like B vitamins, super involved in supporting your nervous system, supporting estrogen elimination, zinc being really important for your thyroid. Thyroid, I think, is another one too that I've seen quite a bit of literature about, right?
I think the main thing that I've read is that it can increase thyroxine binding globulin.
Yeah.
It's like a sponge that soaks up your usable thyroid hormone and renders it unavailable.
Right. Yeah, I've definitely read that too. Yeah, interesting. All of these things are massively important to consider if you're somebody with endo. And I'm similarly to you, I approach this topic, from sort of a neutral perspective. It's not to fearmonger. It's, if you made the decision, especially in the case of endo, because you're living with a lot of chronic pain and you need some symptom relief, like I am all for it. Like I am rooting for you. I want you to do what's best for you, but let's just be aware of what can be happening beneath the surface so that we can work to mitigate some of those, possible side effects and things that could eventually lead to you feeling a lot worse, 5-10 years down the road. Not a super strong study. It wasn't a randomized controlled trial, if I'm not mistaken, but there was one study that I found that showed that being on birth control can actually increase the likelihood of deep infiltrating endometriosis. Not super clear that it's causal or what it is, but also something that I tend to bring up often with
Interesting. I'm curious, was it a certain type of birth control, like combined or progestin only?
I think it was a combo. Yeah, but not a super strong study. So I want to be like super transparent about that. Like, just something to be aware of. Yeah. So Birth Control Breakup Club. This is called it your passion project. Why is it important? I mean, I think we kind of alluded to this already a little bit, but why is it important to prepare for that transition off? And what might that transition off look like? I mean, you kind of already answered that question a little bit, but if there's anything
like
else
I said, I'm working with so many women are on birth control long term. I feel like, and so many are put on birth control for symptom management at such a young age. Like, case in point, I was put on at 18 for really painful periods. Never got worked up for endo. I don't think I have endo. I think I just had estrogen dominance. But I can relate to being in so much pain that you just need something to take it away. But yeah, many of us are on it for 10 plus years, 20 plus years, and we are becoming depleted in this time. Our inflammation is rising. Our detox pathways are being compromised. And so it's really important, I think, to prep ahead of time and start offsetting these negative side effects of birth control before you come off, so that you're in a better state. Like you're supporting liver detox, you're supporting your gut health, you're supporting the nutrients that are depleted by birth control. We're eating an anti-inflammatory diet. And when I say that, I'm not talking anything restrictive. I'm more from a standpoint of, I want you to have the most inclusive diet possible. Like, what can we bring in instead of what can we cut out? But those are the main ones. And I always recommend at least 3 to 6 months of prep. If you've been on it longer, maybe do a longer time span. But some women land in my DMs and they're like, I just quit birth control. What can I do to support my body? And I'm like, okay, first of all, don't panic, because I normally recommend 3 to 6 months of prep. But oftentimes these post-birth control symptoms don't appear for around 3 to 4 months post-breakup. So even if you're like just freshly off, or you're like dead set, you're like, I am finishing my pack this week and I'm done, that's okay. Like, just implement prep where you can, support where you can, to help prevent the onset of symptoms later. Or even if you're in the symptoms, doing the prep is the same remedy quote unquote for reversing those post-birth control symptoms. And it's all so foundational.
Period. Yeah. This may be a bit of a curveball, but are you seeing any symptoms consistently creeping up for women when they're on birth control? Like, are you seeing constipation happening on the pill? Are you seeing a lot of like spotting? Are you seeing a lot of mood shifts? Maybe the pill's causing acne or weight gain? Or is there like a constellation of symptoms that you see creep up often?
I love this question. I'm so glad that you asked, because it really kind of depends on the type of birth control that women are on. I see progestin-only birth controls tend to increase acne. There's a study on this, the way that progestins act more like an androgen in the body. So they're binding to androgen receptors. So women who get IUDs oftentimes will complain of acne. And then the progestin-only ones are also more known to increase risk of anxiety and depression. So I see a lot more mood issues, which is why I asked when you mentioned your mood symptoms on birth control if you were on combined or progestin only. Spotting, I would say that's more so if women have been on it for a really long time. I started to experience that as well, like 8 years into my birth control use, being at the gym doing jumping jacks, going to the bathroom and realizing, oh, hey, what do we have going on down there?
Yeah.
And my OB said it was just because like you've been on birth control for so long and like the uterine lining just like weakens or something like that. But yeah, I'll see that occasionally more so in the long-term users. IBS, definitely. I see more like women complaining of IBS symptoms. And then the vaginal yeast infections.
Yeah, I see that one too. It's so interesting, hey, like when you were saying I was on it for 8 years and I started bleeding, that was also my experience. I couldn't tell you how long it was before I started bleeding, but it's just interesting that the response is, oh, that's like, it happens. It's like something is happening beneath the surface that we're not seeing, and maybe we should be a little bit concerned about it, or like wanting to investigate this a little bit more, Do we understand any of the method of action for some of these? Like with progestin only, so if I had like $1 for every time somebody rolled into my DMs and is like, I have been bleeding for 28 days straight on Bizan or Dianadjust, right? If I had $1 for every time I heard this, because it's notorious. Like it's a notorious known side effect of progestin only is that you do bleed, right? Because the uterine lining is exposed to estrogen. You're not taking a pill that has synthetic estrogen in it. You're only being exposed to the synthetic form of progestin. And so I'm telling them, like, this is happening. Your uterine lining is being exposed to the estrogen, not any progesterone, and that's causing this abnormal spotting. At least that's part of the way that we understand it happening. So if you want to stop bleeding abnormally, you probably need to consider a different option, right? It doesn't happen to every woman, but I do see that happening a lot in the endo population because Bizan and progestin only meds are commonly recommended.
Yeah. So do you favor combined contraceptives for endo population?
I don't actually. So I do, like, based off the research, I would say that the progestin onlys are better in terms of like less side effects, better tolerance. We see really good research with progestin onlys and endometriosis, cysts, and things like that. But also, and this is why, one of my questions on my list of questions to you is like, what can you do to prepare for the transition on, right? Because if I know already before you've considered a progestin only medication, if I know that you're already experiencing a lot of depression, low mood, you're already experiencing like 3, 4, 5 days of spotting before your period starts, these are things that are starting to create a picture in my mind that you might not be the best candidate for this type of a hormonal contraceptive or hormone therapy, right? Because these symptoms are going to be exacerbated by a progestin only pill, right? Similarly to if you're doing a combo with a form of progestin that's more structurally similar to testosterone. If I already know that your androgens are through the roof, you're probably going to get a lot of those symptoms that you alluded to previously around acne, oily skin, hair loss from the head, right? I'm thinking about those things, right? And then if I know that information about somebody, then I can give you some information to use to help you make the decision about which one is going to be best suited to your body. But yeah, I was curious, like, do we understand any of the method of action? So I think we kind of talked a little bit about like the androgen, like the more structurally similar progestin to androgens, maybe potentially leading into oily skin, acne. Do we understand much about why some of these options might cause mood shift? I mean, I imagine it's probably a lot to do with like changes in the gut and serotonin.
What I was gonna say,
Yeah.
gut-brain axis, and then yeah, it's depleting vitamin B6, which impacts serotonin levels, inflammation. I think it's just multifactorial. I don't know that I've read anything specifically about mechanism of action, just so much that it increases risk of anxiety and depression.
Yeah, I think there's probably a few method of actions for sure.
Yeah.
Really cool. So what are some of these like foundational things that you work on? I mean, obviously don't give away Birth Control Breakup Club because,
That's okay. I can give you a tour
to come. Yeah, but yeah, like a tour, like what are some of these like generally speaking bigger foundations that women can be working on in preparation to transition off?
Yeah. So first of all, when a woman joins Birth Control Breakup Club, the first thing we talk about are these side effects of birth control, because I want you to understand like what's going on in your body. How does birth control actually work? Because so many of us don't even realize it's shutting down our own hormone production, at least for the combined contraceptives. And then the progestin only, obviously, we can like 50% of women still continue to ovulate, so then we are exposed to that estrogen. But just kind of giving that physiology, and then like what is our hormone pattern supposed to look like when we're not on birth control? Like hormone or menstrual cycle 101 that we were never taught as women, which is so disappointing. And then we talk about the nutrition action steps, which making sure you're eating enough. We go through like how to calculate your macros and do an audit of your diet and make sure that you're eating enough. That is so foundational to hormone health. Balancing blood sugars, eating an anti-inflammatory diet, again, not restrictive, like what can we add in, what can we focus on to make sure we're including on our plate to help combat inflammation. We talk about replenishing nutrients through diet and through some supplementation, supporting liver detox pathways, I go into all the systems, like supporting gut health, supporting adrenals, supporting thyroid, supporting liver detox. It all just builds on the foundational stuff because a lot of those diet things go into, like we talk about liver detox. What does that even mean? A lot of it is balancing blood sugars, eating enough protein, getting adequate minerals and B vitamins. It's nothing earth-shattering. We don't have to have special liver detox supplements or cleanses. A lot of it is just those foundational things.
Yeah, of course, because if part of what your liver does is help with regulating blood sugars and you're already doing that with a strong foundation in your diet, then of course you're taking a bit of the burden off the liver.
Absolutely.
So besides those foundations, do you have like a favorite support for the liver that you like to lean into more often?
Yeah, I like castor oil packs. I feel like that's super gentle.
Yeah.
I have, like, you can do, Seeking Health has a liver nutrients supplement. Like, if you wanted to be extra, that's not going to hurt. But I just don't want people to feel like they have to do supplements, right? Like, let's focus on those foundational things. And I think that supplements also create a false sense of security. Like, oh, I'm taking this supplement, so I'm good, and I can eat whatever the heck I want without any regard to how it's affecting me. No, we have to have those foundations in place. Otherwise, the supplements, the liver detox is not going to do anything for you.
Yeah.
So big focus on foundations first, but we can definitely utilize additional tools, extra tools, if that's desired and something that you can afford, because supplements can get expensive.
Totally. Yeah, I totally agree with you. I'm going to be super transparent. Like, I think if somebody's coming off of hormone therapy, I like to use some additional liver supporting supplements. Like, I really like Liver Support PX. Love the castor oils. Love like encouraging sweating, whether that's through movement or sauna or like just getting out in the sun. Because I think like, we already live in like a super polluted world, and your body's just been dealing with like months or years of being on a synthetic hormone. Like, I think it could probably use a little bit of that support. So I totally hear you, Jenny, and I agree with you. I just also think like, if you're on the fence about a supplement and you don't want to be replacing one pill for another pill, it's not a bad idea to do something to just support the liver for a month, 2 months, 3 months as you transition off the pill.
Exactly. And I think the timeline of it is something that I'm glad that you highlighted that, because some people like, we start a supplement and then 3 years later we're just like taking the same supplements, and our supplement cabinet grows and grows and grows, and we have to think like, okay, do we really need to be on this long term, or is it like a temporary thing. And
Yeah.
that's how I approach the birth control breakup supplement support. It's like, let's focus on the nutrient replenishment, like 3 to 6 months before, continue 3 to 6 months after. And then if you're heading into a season of trying to conceive, pregnancy, nursing, we want to stay on a prenatal to help support those things. But like, we don't need to stay on these things forever.
Yeah, agreed. So if somebody's watching this and they're like, okay, I'm on birth control, maybe they're thinking that they want to transition off either because they want to try something that's not hormone therapy, or they maybe are looking to conceive in the next 6 months to a year. What are like 2 or 3 actionable things you would suggest?
For like root cause endo support.
Just they're transitioning off, they don't even know where to start. Yeah, they don't even know where to start. They're like, what do I do, Jenny? What's like 2 to 3 actionable things? And of course, with the caveat, these things should be tailored, right? It's not medical advice, but just some things to consider as you're going through the transition off.
Yeah, blood sugar balance, protein, fat, carb at every single meal, fiber. I love a prenatal for transitioning off birth control. Even if you're not planning on coming off to try to conceive, I just think that I love Fullwell prenatal. Seeking Health has a really good one, Needed, but Fullwell is always my go-to. It just provides a really comprehensive nutrient profile to cover a lot of those nutrients that are depleted by birth control, in therapeutic doses. That's another thing too, so we gotta look at the therapeutic dose. I'm gonna throw in castor oil packs again, like a little bit of that extra liver support.
Love it.
And a bonus one, maybe like raw carrot salads.
Yeah,
Because that helps with estrogen detox. A little peel the carrots, shred them up, a little vinegar, a little olive oil, a little salt and pepper, and it's a great little snack tool.
Do you keep the outer skin intact? Just give it a clean, or can you take that off of the carrot?
No, raw unpeeled carrots. I mean, I clean it, but shred it up, including the outer skin. That's the important part, because that carrot peel skin can actually help to bind to estrogen in the gut and toxins in the gut and kick it out. So
yeah, love that. Those are great tips. So I would totally agree. Multi for sure. You're already probably going to be a bit depleted depending on how long you've been on the pill. So love that, and then of course if you can complement that with a nutrient dense, colorful diet, fantastic. Castor oil packs, love that. And you would recommend placing it over the liver?
Yep, right side abdomen, liver, gallbladder.
Cool.
The gallbladder actually takes a hit if you're on combined contraceptive. That estrogen actually thickens up bile.
Yeah.
And biles are detox pathway, and so that can really bog things down. So castor oil packs can help to stimulate bile flow, support liver detox, support bowel movements, which we need bowel movements in order to get rid of toxins as well. So love a castor oil pack. It's multi-use.
Yeah, I love it. Amazing. And then the raw carrot salad, which I love. Yeah, I love that so much. Perfect. Okay, so we've talked a little bit about what transitioning off can look like, and we've dabbled a little bit with this question already, but I'm curious, what if somebody wanted to transition on? And I know that this isn't really at the heart of Birth Control Breakup Club, but we've already kind of talked about some considerations coming on the pill, right? What are some things that you might want to look at? What are some things that, women considering going on some kind of combo birth control, progestin only, IUD, what symptoms might be a bit of a red flag? What symptoms might guide them in terms of picking the one that's best suited to their body? Is there anything that they should be doing pre-transition on that might help set them up for success so that they're tolerating it well and they're not developing those uncomfortable symptoms while they're taking the birth control?
So this is not an uncommon question. I have some ladies slide in my DMs. They're like, I'm about to start birth control. What can I do? And I still recommend Birth Control Breakup Club, not for the sake of like convincing them to not go on it or come off quickly, but because of the prep that I recommend for coming off is exactly what I would recommend for a woman who's starting birth control, and just to continue that support throughout the journey of the birth control to help offset those negative side effects. But I think for like endometriosis patients deciding if you're going to go on birth control, big question I would ask is, are you purely looking for relief, or are you looking for root cause support? Because birth control is a Band-Aid. It's not going to address the root cause, but sometimes we can do both. If you are like, I am in so much pain, I need relief, go on the birth control, but then also do the root cause stuff, like support your estrogen detox, support your gut health, look at iron recycling. I don't know if that's something that you talk about with your population. Yeah, okay. So making sure that you're not you have too much iron, and something with combined contraceptives, those placebo pills actually contain iron. So we're more likely to get iron overload. I see that all the time in women on the combined contraceptives, really high iron levels. And so making sure that we're supporting iron recycling, which basically means that we're supporting nutrient cofactors that keep iron in motion in the body instead of, like, if we don't have enough vitamin A or enough copper, the iron can get stuck in our tissues and feed infections and inflammation. So we want to make sure that we're supporting those nutrient cofactors, and even like getting your iron levels tested to make sure that your iron levels aren't through the roof, and maybe do blood donation if you have really high levels to help keep inflammation down. Sorry, that was like a whole, we could talk all day about iron recycling. Got on a tangent there.
Yeah, but it's a great one to bring up because, like, interestingly, like, I do see it a lot. Like, I just, just the other day working with a client who has major iron overload, been on a pill for several years, looking to transition off for fertility reasons. And it's not rare. Like, I see it a lot. And when you have iron overload with endo, that's going to drive inflammation and pain. It's going to be a source of inflammation for you. So it's a really good point.
Yeah. And I think, do you see iron, like anemia? Do you see low iron in your endo patients from those that are like bleeding so heavily? Do you run into that, or do you run into more of the iron?
Of course, yeah. But like, it's like, I don't know if there's something in the air, but as of late, I've been seeing a lot of that anemia of chronic disease pattern, right? Where the ferritin is sky high and then the serum iron is low, or the TIBC is high, or the percentage saturation is low. So, and this is why, and I don't know, Jenny, if you share in this frustration with me, but this is why I absolutely, I don't know what word to use here, despise, dislike, get frustrated with when doctors are like, ferritin is good enough. No, my friend, it is not good enough, because if your ferritin is at 122 or 180 or 200 and your serum iron is at like 40 or 20, then that is not a sign that your ferritin and your iron status is healthy. It's an indication that you've got a crap ton of iron, of inflammation, and we need to figure out what is happening. Is it the recycling piece that you discussed earlier? Is it that, you've got small intestinal bacterial overgrowth, or you're just like so incredibly inflamed from your endometriosis that it's manifesting in this iron pattern? So anyway, went off on a bit of a tangent there, but I do see that the traditional iron deficiency anemia. I also see a lot of pernicious anemia, so like a B12 deficiency driven anemia. So I see a lot of that pattern, and then I see a lot of this iron overload and or anemia of chronic disease pattern as well.
Yeah. I just think it's an important topic to bring up with the endo population. Like, if you need iron, but also let's support the recycling process at the same time, because if we're not, then we can just kind of compound the issue. So anyway, thanks for chatting about that with me.
Yeah, for sure. I'm so passionate about this stuff, but it's just like crazy because it is literally not enough to just check your ferritin. And like sometimes as a dietitian, you feel kind of like you're stepping on toes, because it's like, you should know this, right? Like, you're the patient's medical doctor. Like, you should be aware that there are different presentations for, these various issues that can occur with iron and iron recycling. So anyway, but we'll stop that tangent there. So what about some other things? Like, we had talked a little bit about spotting before, like already experiencing mood or depression type symptoms.
I think that's a big one. Like, if you're experiencing anxiety and depression, know that a progestin-only birth control could really escalate that. And I mean, from my understanding, I feel like the progestin-only birth controls would be favorable for endometriosis because the synthetic estrogen is so potent, and estrogen fuels the endometrial growth. And so it seems like the progestin only would be more favorable, but maybe not for everybody. But that's something to consider. Like, if you are experiencing a lot of mood stuff, anxiety, depression, know that progestin only birth control could elevate that. And maybe that's your go-to, but then you just make sure that you've got some additional support on board, like some Zoloft, some Lexapro, Wellbutrin, whatever you need. Because I think mental health is so important, and we have to keep that in check. And when those are needed, those are needed. So.
Yeah, totally agree. Another one that I would say, like, I don't know if I would go so far as to say see a lot of, But many birth controls have sneaky ingredients, right? Like lactose or sucrose or some like other sugar alcohol or cornstarch, right? So I don't know if you're seeing a lot of this in practice, but even just being aware that like if you're somebody who's lactose intolerant or you've got like a sugar alcohol sensitivity, because I can't even tell you, like it's not a law, but more than it should be patients who start on birth control, they develop all these digestive symptoms, and then like 6 years down the road, they're like, where the heck did I develop all these symptoms from? And you've just spent 6 years exposed to something that's causing inflammation, irritation in your bowel, and nobody even told you.
This is actually news to me. I didn't even think about hidden ingredients. I wasn't even aware that they contain lactose or cornstarch. So very interesting, and something I'm gonna key into now.
Yeah, definitely interesting. And you alluded to previously the iron. So that's another thing I always encourage patients to look at, right? Like, what is your iron status? This pill has iron. Do you need the iron? Because you might end up putting yourself in iron overload, and that is not ideal for endo.
Yeah. And it's not placebo pills that contain it, so you could always just like not skip the withdrawal bleed, but like, don't take those placebo pills. Still like take a break from your pills, but don't take the placebo ones so you're not getting the extra iron.
Totally. That is an option. Some women with endo, they'll do continuous, right? So they never get a withdrawal bleed, so that's another option.
Yeah.
I mean, obviously this is not medical advice, but like if somebody came to you and they were like, Jenny, I have all these like digestive symptoms. I'm bloated all the time. I'm like swelling. I'm not having complete bowel movements, or like they feel really incomplete, or they're at the opposite end of the spectrum. Okay, it's a bit of a tricky question, but I was going to ask, like, what would you advise? Would you say, don't go on the pill, let's work on your gut? Like in that scenario, does the pill have the potential to make those symptoms worse and exacerbate those symptoms?
It does, but I also understand being in a place of just needing relief. So it just depends on the person. Like, where are you at? How much capacity do you have to handle the pain? Because you can work on root cause at the same time if you're going to choose to go on birth control. But yes, I would not go on birth control and ignore those symptoms. That definitely needs a workup and
Totally.
Get to the root cause of that.
Yeah, I agree for sure. I think I would probably give the same answer. Like I probably wouldn't say, oh, just don't go on because you're having these symptoms. But as Jenny has explained already, like gut health can be made much worse by birth control. So you're definitely not going to want to avoid those symptoms, and especially if you're also living with endometriosis. Many surgeons that I've spoken to recently also say like birth control masks a lot of the symptoms of endo, right? And like so it can be progressing, it can be getting worse beneath the surface. And so if you're already symptomatic going into starting the pill, you really, really want to address those symptoms, even if they are seemingly unrelated to endo.
Yeah.
Okay. Yeah. Any other last kind of like symptoms or red flags or things that you might look at?
I made a list over here to jog my memory. Maybe like increased risk if you already have insulin resistance or increased risk of diabetes. That's something to consider. And I think it's the progestins that can increase that. So just something to be aware of. I know it bothers me so much that birth control is like standard of care for PCOS because like they're already at increased risk of diabetes and heart disease, and birth control compounds on that. So just being aware, and like again, if you need the birth control, you need the birth control, but then doing things to help support insulin sensitivity on the side to combat that.
Yeah, I love that. That's a really good point.
Yeah. And then also you mentioned this in notes, but also obviously fertility goals. If that was a huge consideration when going on birth control, like if you're entering into a season of family planning.
How funny is that, hey? Where like with endo especially, it's like I have a fertility goal, like I'm trying to get pregnant. And I was like, birth control. It's like, no, inconsistent. It's crazy, I know.
I have heard doctors say to people, and I've seen this a lot with PCOS, that if they're trying to conceive, they should go on birth control because it will like improve their fertility, it will get them to ovulate regularly. And I'm like, in what world?
That doesn't happen.
No, ovulation doesn't happen on birth control. Like, I don't know. It's actually mind-blowing to me. It's laughable. Like, what?
Yeah, I was going to say, too, like, with PCOS especially, like, yes, it requires a bit of effort, but the diet and lifestyle like tweaks with PCOS are massively effective for regulating your cycle, for, you know, bringing back that regular menstruation, ovulation. Like, you can achieve that through natural means. And so, like, I can understand being in a stage of life where you're really busy, you don't have a lot of time, you can't really prioritize you. Although, honestly, you know that, like, trend going around where it's like, the things I would say if I wasn't scared to hurt your feelings.
Yes.
Yeah, like, if I wasn't, you know, afraid to hurt your feelings in this scenario, I'd say, like, you probably should be prioritizing yourself. You know what I mean? Like, if you're in a stage of life where you can't really prioritize your health, some things need to change. You know, the priorities need to change. But yeah, very, very effective for balancing the cycles with PCOS. So that's another frustration, right? It's like, it seems like such a simple intervention to go on birth control, but it's really not addressing the root of the problem. And the advantage with PCOS is, like, you can feel so much better and reclaim so much of your quality of life by, you know, committing to these diet and lifestyle changes.
Absolutely.
Okay, cool. Yeah, love all that. And then my last question to you, Jenny, is around, like, a completely unrelated topic. Well, I guess kind of partially related, but you do also specialize in skin, and this is an area that I don't know, like, a ton about. Often when I'm working with clients on improving endo symptoms, yes, we'll see that positive spillover effect into the skin health. But I guess my question is, and this is a big question, but what are some of the most common root cause issues you're seeing for acne, oily skin, these types of things?
Yeah.
Whether related or unrelated to the pill, just so, you know, our listeners have an idea of, like, what are some things they could be focusing on if this is an area where they struggle.
Yeah, acne is such a deep topic. There's so many things that can contribute to acne, I think, from a topical and an internal approach. But one common symptom after coming off birth control is acne. And that is because of something called androgen rebound. When you're on birth control, it's lowering your testosterone. And when you come off, it's like the spring is released and their testosterone rebounds up. Testosterone causes more sebum production, more oily skin that's more prone to breakout. So this is very common in women transitioning off of birth control. That's not to say, like, you're destined for that. Like, you can mitigate that. Like, there are things that we can do to support reduction of testosterone, like spearmint tea twice a day can be helpful. Myo-inositol can be helpful. In the same grain, insulin resistance, high blood sugar levels, insulin resistance can fuel then elevated testosterone. And this is seen a lot in the PCOS population, where we see a lot of that hormonal chin strap acne, jawline acne. Gut health is huge. I see that all the time, specifically I see a lot of H. pylori in my practice, a stomach infection, and that's very linked to not only acne, just skin issues in general, like eczema, psoriasis. So gut is a big one. And I've also seen it as simple as, like, clients aren't eating enough. And I've seen acne completely disappear in 6 weeks just by eating enough and balancing blood sugars, supporting minerals. That's another big one.
Yeah, to bridge that gap, just in case, like, our listeners don't understand, and correct me if I'm wrong, but, like, I always say under eating is always going to be more inflammatory than eating, like, that piece of cheese or that piece of white bread or whatever it is, right? Because gluten and dairy are the big ones in the endometriosis population. It's always going to be more inflammatory. And so when you're not giving your body enough fuel, that, like, skyrockets your cortisol. It sends the wrong signals to your adrenal glands. And then also, you're probably not getting enough nutrition, various nutrient gaps. This is my understanding anyway, can contribute also to like acne and oily skin. Was there anything else I missed there in terms of, like, how under eating could be fueling that?
No, I always say making sure that you're eating enough and balancing your blood sugars ensures that you're running on thyroid hormone and not adrenaline or cortisol, because it really is taxing on those adrenals.
Yeah, I love that. And what about, like, electrolytes? I hear a lot of, like, skin specialized professionals talking about electrolytes with skin health.
Yeah, electrolytes, minerals, same thing, right? Like, when we talk about minerals, we're talking about sodium, potassium, magnesium, calcium. And so that's huge. I do a lot of hair tissue mineral analysis in my practice. Like, I would say I don't even really need to, because everyone needs minerals. Everyone needs mineral support. But actually, there was a colleague of mine in a continuing education program that I was in who had really bad acne, and she shared the success story of just adding in electrolytes, or mineral mocktails is what you call them, where it's sodium, potassium, magnesium. her skin cleared up just from the mineral mocktails. It's insane.
Yeah, interesting. I don't know what the method of action is there, but I imagine like, you know, our mitochondria rely so heavily on sodium and potassium,
Yeah.
so I wonder if it has something to do with that.
I think it's so deep. I mean, minerals are the spark plugs for our cells. So like
Right,
it's down to
right.
a cellular level with that, and there's probably so many mechanisms of action.
Yeah.
But
I like
yeah.
analogies. I'm not always very good at them, but I can imagine like if I'm like super sleep deprived, I'm probably not going to put myself together as well as I would if I have like a full 9 hours of sleep and I've had like a beautiful high protein breakfast. So I'm just like
Yeah.
picturing these cells working on fumes and
Oh yeah.
you know, maybe that's, you know, part of how it manifests, right? You're just not able to generate fuel as well for your body as you otherwise would be able to.
Yeah. And actually, as you're saying that, I'm thinking of like I picture them as like little shriveled up raisins when we should have like big plump grapes.
Yeah.
And when it comes down to like that cellular level, we are talking about mechanism of action, the sodium potassium pump. Like if you go back to fourth grade science, Krebs cycle, all of that conversation, we have the sodium potassium pump on every cell. We need potassium to get nutrients and hormones into the cell. Like we can be, when it comes to like thyroid health, for example, we can have plenty of thyroid hormone. We can be producing it beautifully. But if we have like, let's say really high calcium levels and really low potassium levels, that thyroid hormone is not going to get into the cell to be used intracellularly. And we have this picture of you have all of these hypothyroid symptoms, but your levels look great. Your doctor's like, oh, you're fine. Your labs are normal. It's all in your head. But could be totally improved by optimizing mineral status to actually get that hormone into the cell.
Yeah.
So that's a more clear example for somebody that needs the picture.
Yeah, I love that. That's really, really well said. And there's probably a few reasons, as Jenny has explained, for why the electrolytes help with skin and energy and vitality and all that. But bottom line is make sure you're getting enough, whether that's through like good quality sea salt or like a pre-made electrolyte powder, through avocados and lentils and coconut water and things like that. That's a very common deficiency I see too on HTMAs. Yeah, and like you alluded to, potassium being very, very important for the thyroid, for energy, for nourishing the cells. So love it. Love it, love it, love it.
Yes.
Okay, cool. Well, I think I've kept you long enough. Thank you so much for your time and your expertise. Did you have any final thoughts, whether it's somebody, you know, really worried about coming off birth control or transitioning on or concerned about their skin? It could be super general. Just like, yeah, any final thoughts?
Yeah, I think just validation. Like you're not alone. There are so many women that are going through this. It is a very normal feeling to be scared when you've been on birth control for so long, especially if you started it for any kind of symptom management. Because when you're coming off, you're not only afraid of those post-birth control symptoms, but you're afraid that those original symptoms will come roaring back. Like for me, I was terrified that my periods would go back to being cripplingly painful. Fortunately, they did not.
Okay.
I think I just maybe outgrew that or knew more about nutrition and its impact on estrogen detox and all of that. But then, unfortunately for me, I got that slew of new symptoms that I had never experienced before. But yeah, just don't let anyone tell you that it's in your head or that you're crazy. I've just heard some doctors be so dismissive, and it makes me sick to my stomach that there are medical practitioners out there that are just so dismissive and yeah, I've heard some horrible things. So
Yeah.
always advocate for yourself. That's what I want to say.
Yeah.
To wrap that up.
Totally agree. Or that like there's no such thing as, you know, having these symptoms coming off the pill. That is very untrue. It's actually a reality for, I would say, majority of women transitioning off the pill to have some
Yeah.
collection of these symptoms, or that there aren't other symptoms or side effects that you need to be concerned about when it comes to birth control. You know, shy of like the big ones that you mentioned, like around clotting. No, there are tons of things we should be considering transitioning on birth control or transitioning off birth control. So yes, I concur.
Yeah.
I agree with all that, very much so.
I think another one too is, oh, sorry. I just had one final thought. Don't let them tell you that you need to go back on birth control to get rid of these symptoms, because that's another one that I hear all the time. They have these post-birth control symptoms and the doctor's like, well, just go back on birth control. And it's like, well, that's not going to fix anything, because if you want to have babies at some point, you're going to have to come off again and we're going to be back in the same position. So
Right. And I mean, for more reasons than just that one, but like, and we've already talked at length about this in the video, but the effects on the gut, the effects on the thyroid, on your mood, your neurotransmitter production. So, but yes, totally agree with that. And, you know, I don't think that every doctor is like, you know, has ill intentions, but sometimes it's just that they're limited in terms of what they can offer you. But yeah, I mean, if you're in this position, if you're looking to transition off and you're looking for natural alternatives to, you know, feeling well off birth control, you can find Jenny's Birth Control Breakup Club link below.
Yay.
That's a good way to end off, I think.
Yes.
Okay,
Thank you
awesome,
so much
Jenny.
for having me. This has been a delightful
My
conversation.
pleasure. Yeah, I love it. Love it. All right. Thank you so much. Thank you so much for tuning in to today's video. If you enjoyed it, please give it a like, and I'll see you in the next one.